Hello, my name is Macy Smith. I'm going to go ahead and do my postpartum assessment. So before I enter my patient's room, I'm going to check my doctor's orders to see if we have any, and I'm going to go ahead and enter the room. Knock, knock, knock. Hello, Miss Jones. My name is Macy. I'm going to be your nurse today. Provide for privacy. Wash my hands. Put on gloves. Can you tell me your name and date of birth? She tells me, checking it with her ID band, and if we do have the right patient. All right, Miss Jones, we're just going to go ahead and do a quick assessment on you. She says, okay. When is the last time that you urinated? She says she just went. So we're good to go there. We just want to make sure the bladder is empty before we start the assessment. All right, Miss Jones, I'm going to go ahead and expose your chest here for just a minute. All right. So we're gonna make sure she has her bra on. We're gonna check her breast for any redness, engorgement. If she's breastfeeding, we're gonna look for cracks and bleeding. She doesn't have any of that, so that's all within defined limits. If she is breastfeeding, we're gonna teach her how to not stimulate that. Or if she's not breastfeeding, we're gonna teach her how to not stimulate the milk. She says we're good to go there, so we're gonna go ahead and listen to her bowel sounds before we palpate the uterus. I'm going to expose her just a little more here. I'm going to go ahead and listen in all 4 quadrants. Bowel sounds are active in all 4 quadrants, so we're going to go ahead and stabilize at the bottom of the uterus. At the top of the fundus, we're going to feel, make sure that it's firm and feels like a fist, and it is even with the umbilicus, and it is. If the fundus were not to be firm, we would do a fundal massage until it becomes firm. So we are good to go there. Ms. Jones, when was the last time you had a bowel movement? She says she had one this morning. Did you have any pain with or anything? She says no, everything was normal. So we're good to go there. Ms. Jones, we're going to go ahead and roll you over on your side. We're going to check for lochia, episiotomy, and hemorrhoids. So we're going to go ahead and roll over. I'm going to hold her up here looking. She doesn't have any hemorrhoids. The episiotomy looks good, no infection, and her bleeding is scant, so that's all normal. So we're going to roll her back. I'm going to remove my gloves, wash my hands, put on new gloves. Ms. Jones, have you had any pain in your legs? She says no. I'm just going to go ahead and check them for swelling, see if you have any redness there. I'm going to expose your legs. So we're checking the legs, no redness or swelling to be seen. I'm going to feel, she says she doesn't have any pain, she has good pulses. So I'm going to look at her arms, nothing there. If one leg or the other were to be swollen or red, that would be indicative of DVT, so that's why we want to check that. Checking the face for swelling, she doesn't have any of that either, so we're good to go there. Ms. Jones, are you in any pain right now? She says she's in a little bit of pain, so we would check our doctor's orders to see what PRN medication was prescribed for her, and we would get that when we leave the room. Ms. Jones, are you bonding okay with your baby? She says yes. Well, I'm all done. Can I get you anything else? She says no. My name is Macy. I will be your nurse. I'll be back in here to check on you. I'm going to lower the bed, put the call light in reach. If you need anything, don't hesitate to hit the button. I'm going to cover you back up here. And I would exit the room and document.